Okay, very warm welcome to everybody who's joined us today. We are very happy to have you here. I'm Manasi and I work with the Bengaluru Sustainability Forum. For those of you who don't know us, Bengaluru Sustainability Forum is an inter-institutional initiative, and we look at fostering interdisciplinary and collaborative approaches towards finding towards a sustainable future for the city of Bangalore. We do multiple things like retreats, panel discussions, webinars, film festivals, exhibitions, workshops. And we also run a small grants program where we support local innovative on-ground projects in the city. The idea is to build this network of smaller initiatives which feeds into the larger goal of sustainability for Bangalore. We have Biome, APU, Azim Premji University, IIHS, Science Gallery Bengaluru, NCBS, and Wipro Foundation, which are our partner institutions. And we work primarily in the thematics of urban biodiversity, water, climate change, waste, and mobility. So over the course of this year, we have been working on a series called the Climate Charche series. Dr. Subbu, if you can go on to the next slide. Yeah. So the Climate Charche series essentially is an initiative to facilitate an understanding on the impact of climate change on the lives of citizens and how that interconnects with various public systems in the city. We wanted to better understand how communities and groups are adapting to local challenges. And we wanted to focus on resilience, on how we can build resilience towards all these problems that we are now facing in the city. And with that, we've been doing multiple engagements as part of Climate Charche series. We did a series of lectures for the architecture students at the CMR School of Architecture to give them a certain climate and sustainability perspective. We have done focus group discussions with communities in the city. And we have also engaged in a collaboration with CSTEP to do multiple engagements around the work that their teams are engaged in. And today's webinar is a part of that. And so I would like to take this moment to introduce Dr. Subramaniam, who is the sector head in air quality. He holds a PhD in mechanical engineering from Carnegie Mellon University, has a postdoctoral training from the University of Illinois, Urbana-Champaign, and droplet measurement technologies. He's also completed an MTech in energy systems engineering from IIT Bombay and a BE in automobile engineering from the University of Mumbai. Before joining CSTEP, he was a senior scientist at the Qatar Environment and Energy Research Institute and has held research roles at Carnegie Mellon, RTI International, DMT, and others. He's currently a research fellow at the Kigali Collaborative Research Center, a visiting researcher at OSU FLUV, and an adjunct professor at Carnegie Mellon University. His research primarily focuses on air pollution characterization and source apportionment, using both high-end and low-cost instruments. And we are very happy to have him here. Thank you so much, Dr. Subramaniam. And thank you to the to Anshika and Swagata from CSTEP. They have been a huge help in organizing today's webinar. And before I hand over the mic to Dr. Subbu, couple of housekeeping rules. We really request you to keep your mics on mute so that there's no overlap and there's no confusion for the rest of the participants. If there is a question that you need to ask, or if there is some term that you would like more clarity on, we request that you type them out in the chat and we will answer them. Of course, there is time for Q&A post the talk, but we really would appreciate if you all don't interrupt while the talk is on. Welcome once again. Dr. Subbu, over to you.
Great. Thank you so much for this opportunity, and welcome everybody. And Let's hope. So when BSF reached out to us to give a talk about air pollution in general, we were trying to figure out what's the best way to introduce this. And so I think the goal is essentially to explain what is air pollution, what are the different sources, how do we work on controlling air pollution in Bangalore in particular, also in India generally, and also talking about some of the climate linkages. So I'd like to really thank my colleagues, Swagata De and Anshika Srivastava, who helped in putting together this presentation. And so a brief about CSTEP. We are the Center for Study of Science, Technology, and Policy. We were founded in 2005, so we just entered our 20th year. We are based in Bangalore. We also have an office in Noida. We are an institute of repute, as I'll explain, the National Clean Air Program. It has a system where think tanks and universities work with cities across the country to improve their air quality. So we are currently tasked with assisting Karnataka State Pollution Control Board on improving their air quality under the NCAP program. We also work with other pollution control boards and city and state governments across the country. We use observations and modeling to develop air quality policies. We have research staff of about 20. Almost half have PhDs, and our goal is to advance scientific air quality management in India through developing modeling observational policy tools that can be used to formulate new air quality policies and track their implementation. And as part of building the ecosystem, we will be sharing these tools with other think tanks and government bodies so we can collectively work together towards clean air for all. And part of our work, of course, is doing outreach and working with the community as well so that they understand air pollution and they can also do their part in terms of controlling air pollution, as we'll talk towards the end of this discussion. And so, as I said at the start, what is air pollution? The World Health Organization defines or describes air pollution as contamination of the outdoor or indoor environment by any chemical, physical, or biological agent that modifies the natural characteristics of the atmosphere. And you might have heard of things like air quality index or PM2.5. You might have even heard about ozone. Overall, these pollutants together, they're estimated to cause about 7 million premature mortalities. And what that means is that somebody who is expected to live up to a certain age, they don't live as long. You might have seen another metric of describing this loss of life or shortened lifespan, as in if you spend your life in Delhi, your expected lifespan is about 6 years lower, according to some estimates. In other parts of India, it might be 1 or 2 years. In some place like the US, you might be losing about 6 months of your expected lifespan if you're not exposed to high levels of air pollution above the WHO guidelines. And the pollution comes in two. One, that you're exposed to outside, when you're outside the house or outside of outside environment, that's ambient air pollution. That's estimated to cause about 4 million premature mortalities worldwide. And household air pollution, which a lot of which is what you're exposed to at home, oftentimes associated with solid fuel burning when people burn wood or cow dung or other solid biofuels for cooking or heating, and that's estimated to cause about 3 million premature mortalities worldwide. And both short-term and long-term exposure to pollution are linked to premature mortalities. There are also productivity impacts. It reduces, a number of studies have shown that it reduces productivity in physically demanding jobs. It's linked to neuroinflammation in the brain, so causes cognitive deficiencies. In utero air pollution exposure, that means if the mother is exposed to air pollution, then the fetus is as well, and that's eventually linked to reduced academic performance. And finally, in the climate linkage, there are super pollutants like black carbon. We call them super pollutants because they are a significant contributor to air pollution, but they are also climate forcers. And black carbon in particular is a short-lived climate forcer that I'll talk about in a little while. And so just briefly, black carbon, this is some work that we did last year when we launched a policy brief at last year's COP. Now COP again is starting next year in Azerbaijan, next week in Azerbaijan. And so the black carbon emissions from various combustion sources lead to increased melting of glaciers and snow and ice in the Arctic and the Himalayas and the Andean glaciers. It can also disrupt monsoons in India and West Africa. And so these are some critical climate tipping points, essentially points where once that system changes, then it's irretrievable. It cannot come back. You cannot reverse it. And so we really want to avoid hitting these critical climate tipping points. And so black carbon plays an important role. And so by reducing black carbon, we can delay or avoid the global system from hitting these critical cryospheric tipping points. And so air pollution does play a significant role in terms of climate change as well. Just coming back to India, so this was a study that was published in 2021 in Lancet Planetary Health that looked at the health and economic impact of air pollution in the states of India using the global burden of disease. It estimates there's about 1 million deaths due to outdoor air pollution in India. So remember, I said globally about 4 million deaths are associated with premature mortality, out of which 1 million are in India. Household air pollution, about 600,000 premature mortalities in India. And the economic cost of this is estimated at about $37 billion, around 1.36% of India's GDP in 2019. And you can broadly see some of the typical areas. So the graph here in maps of India here, plot A here shows the population-weighted PM2.5 exposure. So you can see Delhi, Uttar Pradesh, Haryana, Bihar, all in the dark red. So significant pollution there. Yellows are more moderate pollution. We are in the light blue here, which is among the lower levels, still well above the World Health Organization guidelines. And there's, of course, some of it is linked to the population using solid fuels. There's also ozone is also a significant problem. So in Karnataka, ozone can be a major issue. And finally, especially in the Rajasthan, Madhya Pradesh, Uttar Pradesh, North India, significant loss of GDP due to air pollution. And so it has both the health and economic burden in India can be significant from air pollution. And that's why we really want to reduce air pollution in India. And so these are some of the diseases that are associated with air pollution. Almost 30% of the premature mortalities are due to ischemic heart disease. 32% are from chronic obstructive pulmonary disorder, so disease, so COPD. There's lower respiratory infections, neonatal disorders. Stroke is a huge component as a result of air pollution. And so, a number of these diseases have been well established as linked to air pollution. And when we talk about air pollution, what exactly do we mean? So typically you'd have heard the term PM probably, maybe, and that's particulate matter. These are solid or liquid particles. And the most common example that I can give you is really diesel exhaust. So if you're sitting in traffic and you see a truck and you see a black plume of smoke coming out from the truck, that's a lot of particulate matter. That's black carbon, that's particulate matter. Most of it is PM2.5. Typically, that's particles smaller than 2.5 microns. And PM10, which is also common, is particles smaller than 10 micrometers. An easy way of understanding this is whatever you breathe that enters your nose is typically PM10, so it goes into your respiratory system. 2.5 microns are the smaller particles. They are more likely to reach your lungs, whereas the particles from 2.5 to 10 micrometers, they usually get stuck in your respiratory, throat, respiratory system. And so your 2.5 micron PM2.5 are really the particles that are most associated with heart disease, for example, and stroke, because some of the particles that eventually make it out to your bloodstream and make it out to your brain even. Primary PM is typically particles that are emitted directly from diesel exhaust or dust or wood smoke, incense, and candles. When you see smoke, those are particles. Secondary PM, so when you smell something, those are volatile organic compounds. That often converts from gas to particles in the atmosphere under certain atmospheric conditions. That's called a secondary PM. There's also sulfur dioxide that's emitted from coal burning that gets converted to ammonium sulfate eventually. That's also a form of PM, PM 2.5. Then there are all of these gases like ozone, nitrogen dioxide, sulfur dioxide, ammonia, and carbon monoxide. The main pollutants in any city are typically PM, PM 2.5, PM 10, ozone, and nitrogen dioxide. If you are in an industrial area, you may have significant contributions from sulfur dioxide. And then finally, going on to particular species, you have species like benzene and benzoylpyrene and toxic metals like arsenic, nickel, and lead. So these are all the part of our national clean air program as well. Air pollution regulation in India has a long history. The Air Act was in 1981-82 and amended, and the national ambient air quality standards were set in 1994. We have had ambient air quality monitoring for a long time, and in 2009, it was officially renamed to the National Ambient Air Quality Monitoring Program, and a lot more stations were added. I'll talk about that in a minute. In 2014, we started talking about air pollution in terms of air quality index because for a simple reason that when you talk about PM 2.5 and I tell you it's 27 microgram per meter cube, you may not know what that means in terms of hazards. Is it healthy? Is it unhealthy? And so the AQI allows you to actually translate that into an easily recognizable metric. And then, of course, there's the Graded Response Action Plan. I think that came up in Delhi in response to the high pollution over there in 2017. Finally, the National Clean Air Program that I'll talk about launched in 2019. It is supposed to end in 2024, but then some states did not make enough progress, and so the timeline is extended to 2026, with targeting a greater reduction in PM10, which initially was 20 to 30%, and they said we can reduce it to 40% by 2026. You give a couple more years. So what are the National Ambient Air Quality Standards? These are set by the Central Pollution Control Board. They are the maximum concentration of the pollutants that can be present in the air. It depends on the averaging time period, daily and annual averages or 24-hour maxima. And they're set for 12 pollutants: PM 2.5, PM 10, sulfur dioxide, nitrogen dioxide, ozone, lead, carbon monoxide, ammonia, benzene, benzoylpyrene, arsenic, and nickel. Obviously, when I started talking about the World Health Organization, so that talks about the global studies all over the world, and basically looking at the guidelines the WHO selects are based on a large number of epidemiological and toxicological studies, and they say what is the minimum level at which at which health effects are still observed. And so the WHO says the PM 2.5 annual average should not be greater than 5 microgram per meter cube. The standard in India is 40 microgram per meter cube. For PM10, the WHO recommends no more than 15. Our standard is 60 microgram per meter cube. So there are definitely some differences in there that we need to watch out for. And some of this is rooted in the fact that our air pollution program is still very young. We still have a long way to go. So suddenly changing from 40 to 5 would be really difficult. But one thing to keep in mind is any reduction in air pollution will always bring a health benefit. So even if you go from 40 to 30 microgram per meter cube or 50 to 40 microgram per meter cube, you will still save a lot of lives in India. So you don't need to go all the way to 5 to save as many lives as possible or reduce morbidity and sicknesses. So the National Air Quality Monitoring Program, or NAMP, it's a pretty comprehensive program. And so this is some of the guidelines that the CPCB says. For a population of about 1 to 5 lakhs, you need a total of 4 stations, 3 under the manual NAMP and 1 CAQMS, for example. So the NAMP is largely a manual monitoring program where people collect filters twice a week for 24-hour average samples. And most of them are in the urban network. About 883 such sample collecting stations are operated across 379 cities. They sample for at least 16 hours a day and 40 days a week, though officially you do need to collect, I think, 104 days a year. The NAMP focuses on SO2, NO2, PM10, PM2.5, CO, and ozone. And of course, they're manual, which means that you collect a filter or a subsample on a substrate, and you take it to a lab for analysis. And so between the sample collection and the time that the data are reported, there is a significant lag. So you can't really know what is the air quality as it's being measured. And the advantage of knowing what the air quality is as it's being measured is that you can actually warn people to take protective action or take some preventive action or emergency measures. So we now have the continuous ambient air quality monitoring stations, or CAAQMS. India has about 560 stations as of today, I guess. They measure real-time PM10, PM2.5, NO, CO, NO2, sulfur dioxide, ozone, ammonia, benzene, as well as some meteorological parameters. The data is converted into what is an air quality index, or AQI. It's not a very even network. Delhi is very well monitored. Karnataka, there's 41 stations, but 14 of those are in Bangalore, the remaining are across the other 17 cities and towns. The data are freely available on the CPCB website and the Samir app. So basically, this is what the station looks like. It's pretty, it's a small room. It's air conditioned because the instruments have to be operated at a certain temperature and relative humidity. And then you got all of these sampling inlets sticking out the roof. And you have continuous monitoring, and you have weekly and fortnightly calibration checks. So a lot of effort goes into this. Each CAQMS station costs about 1.5 crores. And it requires a lot of maintenance and upkeep. So maintaining such a big network is a daunting task. But India has managed to do this so far, even though we do need to have more monitoring stations around the country. So the AQI is an easy way to inform the general public about air quality levels and provide health guidance. So you can see these colors. The green is the good, the light green is satisfactory. So there is a way to correlate the ambient measurements with the standards. And so ideally, you want to be in the good or satisfactory category. But if you go to the moderately polluted, it can cause breathing discomfort to people with lung disease, such as asthma and heart disease, also to children who still have very developing lungs, and older adults. And with the poor, very poor, and severe categories, the health impacts significantly worsen. So, I mean, even though it might be paradoxical, some of you might have seen headlines that say air pollution in Delhi improves to very poor. And someone might think, well, how can it improve to very poor? That's because previously it was severe and the levels were very high and the levels have gone down. So it's improved to very poor or poor. But as the levels go up, then it consequently degrades, and thus you may have to actually stay home, for example, or wear an N95 mask. So what is the Clean Air Program, National Clean Air Program? The NCAP was launched in 2019. It requires coordination across multiple government agencies and departments to reduce urban air pollution. It's very focused on city-specific air pollution. The initial target was to reduce PM10 by 20 to 30% by 2024. Now it's been revised to a 40% reduction in PM10 by 2026. It's in consonance with the AD Act, and it's governed by the Ministry of Environment, Forest, and Climate Change that sets the overall policy and guidance with the help of the CPCB. The state pollution control boards do monitoring and enforcement of industrial pollution. The actual implementation to take different actions is left to the municipal corporations like BBMP and urban local bodies like DULT, as well as, and then research and academic institutions, as well as think tanks like CSTEP, then provide knowledge support as institutes of repute to these government bodies. So, like I said, what are non-attainment cities? If your air pollution exceeds the national ambient air quality standards, that's generally called non-attainment, but it needs to meet certain criteria. So, for example, 131 cities across India have been designated as non-attainment cities under NCAP, and that means the city where PM10 has exceeded the NACs for 5 consecutive years. Or there are some cities that are large, like over 1 million population or 10 lakh population, that are also included in this. There's a few cities like that, like Chennai. A total of 131 cities fall under NCAP regulations. So Maharashtra has 19 cities, UP has 17 cities, Andhra Pradesh has 13 cities. In Karnataka, there are 4 cities: Bangalore, Davangere, Hubli, Dharwad, and Kalaburagi. So each city has to make city cleaner action plans with sectoral strategies, targets, and the funding provided by the 15th Finance Commission, implementation by city departments and urban local bodies, particularly the transport department. And cities are supposed to submit reports every quarter to the Prana portal as well. So some of the major initiatives under or augmenting NCAP includes, like I said, city level action plans. So as I'll talk about in a minute, pollution is not limited to cities. So you often want state level or regional action plans. Delhi, in particular, Delhi NCR under the CAQM has the GRAP program that takes action when a pollution exceeds a certain level. We do need to do monitoring of air pollution in cities. Like I said, as part of NCAP, cities have to also develop an emission inventory, do some source apportionment. Emission inventory basically means where are the emissions in a city coming from, and what sources, what is there is an emission factor, for example, per truck, and then multiplied by the number of trucks, or industrial air pollution similarly. Or the other way is source apportionment, where you capture particles on a filter, look at some chemical components, and try to identify the sources to that pollution. You can also do carrying capacity studies. For example, if you have an industrial area, you want to see how much you can add industrial activity to that area, whether it would violate the NAC standards, the NACs, then you do a carrying capacity study. And of course, there needs to be capacity building for government officials. The national air quality action in India is still very nascent. And so government officials tasked with implementing NCAP need to understand what are the different what is the importance of air pollution, and what are the actions they can take to improve air quality. So there is also public awareness and education that we can do under NCAP. So in particular, Bangalore as a non-attainment city, of course, it's a national level. The national policies and framework, like I said, are set by the MOFCC and CPCB, but the Karnataka State Pollution Control Board monitors air quality and ensures compliance with environmental regulations. It collaborates with local bodies to implement air quality initiatives, and the actual implementation is left to the Brihat Bengaluru Mahanagarpalike, who coordinate with KSPCB and community groups to address air pollution sources. So a couple of years ago, we conducted an emission inventory study of Bengaluru, the 60 by 60 square kilometer area around Bengaluru, around BBMP. And we did this at 1 square kilometer resolution. And we have published the results on our website, cstep.in. And we have shared this with the Karnataka State Pollution Control Board, who have used the results to identify hotspots in Bengaluru, and they're working on hotspot action plans accordingly. So what have we found? So on the right here, that is the spatially resolved pollution. And you can see generally the outer ring road as a major source of pollution, as well as these inner parts of Bangalore where there's a lot of traffic. And so the transportation emissions, mostly from diesel trucks and heavy commercial vehicles and light commercial vehicles, we estimated them at 63% of the PM2.5 emission loads in Bengaluru in 2019. Waste burning is about 10%. DG sets are about 10%. Road dust is 7%. There's also restaurants and domestic sources and construction demolition. And so what can we do about these different sources of air pollution? So some of the recommendations that we have given, and we have looked at different targets of course, this is a study based on 2019 that we completed in 2021 or 2022. And we said these were targets to be achieved by 2024. We're still far from that. So we said there's a number of trucks that can be retrofitted with diesel particulate filters, or two-stroke autos to be replaced by CNG autos. Of course, a number of vehicles are increasingly electric, so that's helping the cause. BMTC has bought a number of newer vehicles, which are all BS6, which are significantly cleaner than the older buses. As well as there's a plan to buy a number of electric buses, hundreds of them. I think we already bought like 300 electric buses. We need to buy more. We need to definitely do some controls on waste burning, reduce the amount of solid biofuels that are being used, get more people using the Pradhan Mantri Ujjwala Yojana to have cheaper LPG, or other households can use induction stoves, and obviously do green construction, or ensure uninterrupted power supply so that we use DG sets even less. And so these are some of we can project it out if we implement this, how much is the reduction in emission load. But these are emission loads or tons per year. They don't really tell you what is the reduction in air pollution in terms of concentrations, or that microgram per meter cube. Your annual average standards from the NACs are based in PM microgram per meter cube, or ambient concentrations in the pollution you breathe. But the city-specific emissions are not the only contribution to air pollution in a city. Basically, you have industry as well as households and restaurants and other sources that emit pollution that are transported by the winds. And these can be from other parts outside of Bangalore, for example, and they get transported by winds to other parts. There is some atmospheric chemistry that happens. And I don't know what that is. And essentially, you can see this simulation. We do what is called a chemical transport model, which basically tracks the pollution. So you can see this coming out from Pakistan through Punjab, Haryana, Uttar Pradesh, going over the Bay of Bengal, and then eventually making its way even to Bangalore. And so we do this modeling using a combination of emissions, weather modeling, as well as atmospheric chemistry. And so these are some model results that our group has developed. These are still preliminary, so please do not cite it. But essentially what it says is that the winter season, most of the pollution goes from Karnataka, goes out over the Arabian Sea. In the spring, winds are lower, so it mostly stays within the state. Monsoon, obviously, there's a lot of washout that happens, so pollution is lower. And again, in autumn, it starts moving out again. But this means, when the pollution is coming from Karnataka towards the west, that means pollution is coming from Tamil Nadu or Andhra Pradesh into Karnataka as well. And so we really need so NCAP as currently formulated is focused on cities, but we really need a regional framework to account for pollution coming into Bangalore or other cities from other parts of India. And so we did some modeling where we looked at the different source regions and see what they contribute. So the bottom dark blue bar is what are the emissions from Bengaluru urban that contributes. And here, the x-axis is the season, December, January, February, which is the winter, June, July, August, September, which is the monsoon season, March, April, May, the October, November season. And the y-axis is a percentage of ambient PM 2.5 that comes from each of these regions. The dark blue is Bengaluru urban. You have this purple color, that's Chikkabalapur, Tumkur, and Kolar. This green is the Andhra Pradesh. This magenta is Krishnagiri district in Tamil Nadu. This is the rest of Tamil Nadu, and this is the rest of India, basically. And what you can see is that in the winter season, when typically pollution is highest, Bengaluru urban itself only contributes about less than 30% to our PM 2.5. Most of it really comes from other parts of India, especially, and whereas in the monsoon season, our emissions are about 50% of our PM2.5. And if you expand it to the 5 districts, Ramanagara, Bengaluru Rural, Chikaballapur, Tumkur, and Kolar, then Bengaluru plus the other 5 districts contribute almost 85% of the PM2.5 in Bengaluru, and as well as the rest of Karnataka. So in the monsoon, it's very much a state problem, significant local problem. But in the winter season, there's significant contributions to Bangalore pollution from other parts of India, even as far away as North India. And so what really this means is that while we definitely need to take action on air pollution from Bangalore, we actually need to work with our neighbors, other districts, even in Tamil Nadu, to control their pollution, because their pollution reductions can benefit us. Our pollution reductions can also benefit them when the wind is blowing from us to their district or to their state. So overall, based on our emission inventory, what is polluting our air? So transportation emissions contribute to 51% of our PM10, 63% of PM2.5, and 65% of our NOx. Trucks and buses are about 1.8% of total vehicles, but 57% of the PM emissions from transportation. Diesel cars also are a significant contributor, though the numbers are decreasing by the year. Road dust and construction dust are another significant problem. Waste burning and diesel generators again. We need to look at some of the neighboring districts that also contribute pollution to Bangalore. So cleaning their pollution would benefit them as well as us. And then, so there are different things that we can do, like retrofitting DG sets with emission control devices, on-road remote sensing to capture super emitter trucks. You might have seen trucks that have like this black billowing smoke plume. That's a super emitter. If you can capture those and fix their emissions, that would significantly reduce on-road pollution. Finally, electrification is definitely the way to go. So one of the pilots that we did really is to have a rooftop solar photovoltaic for electric vehicle charging. So there's a pilot that my colleagues at CSTEP have implemented at BESCOM, at the BESCOM office in Bangalore, and it's been running successfully for a few years now. And my colleagues in the green mobility team at CSTEP have estimated what are the subsidy costs for expanding the electric vehicle charger network in Bangalore here as well. So it's a few 100 crores. You can do a lot of good, feed a lot of electric vehicles as well. Going back to black carbon, really, and looking at the black carbon air pollution climate linkage, some of the solutions that have been implemented globally are, for example, Lighting Africa, which is now called Lighting Global. So kerosene lamps were used for lighting in a lot of African countries, and they have been replaced with solar home systems. So there has been significant reduction in fossil fuel usage, as well as reduction in air pollution emissions, reduction in household air pollution as well because of that. In the Arctic, obviously, it's really, they used to use a lot of diesel because they need a lot of warming as well as lighting. They didn't have a lot of power plants up there, but there is a program to have solar power and wind turbines that reduces the emissions of diesel exhaust in the Arctic. And that's particularly sensitive because diesel exhaust emissions from the Arctic are quickly deposited onto the Arctic sea ice or the Arctic glaciers, and that leads to faster melting of the sea ice. We want to avoid that. Brick kilns are a significant contributor to black carbon in India. And this was actually, I believe, in Nepal. And a lot of them have been converted to zigzag kilns. And a similar program is underway in parts of India as well. And that can be a significant reduction in air pollution and black carbon, which is relevant for climate purposes as well. Forest fires are a significant contribution to air pollution, but community fire management can reduce wildfires, which can reduce those emissions as well. This is an example from Ghana. There's also an example in northern India where communities are engaged as well in reducing, in putting out forest fires. Last slide, really, last couple of slides. My colleague Nirav Lekinwala took a picture last week of Diwali smoke, basically, fireworks, and that leads to a lot of smoke. We did see significant increases in air pollution then. But so those are really Diwali and the next day celebrations, Rajotsava celebrations. A lot of fireworks were emitted, were burned, burst, and that created a lot of air pollution. You can see this in the data across the country as well, where generally your levels should be maybe 100, 200 micrograms per meter cube of PM2.5, which are bad enough. But Diwali night and the next night, it reached 700 microgram per meter cube in Ghaziabad, or over 300 microgram per meter cube in Kolkata, Pune, Indore. Of course, Delhi was also higher. So those are definitely big sources of air pollution. There's, like I said, diesel trucks, waste burning, road and construction dust, diesel generators, solid fuel burning. But you may not necessarily have a regulatory monitoring station right next to all of these fireworks. So how do you actually, or to some of these significant local sources? So how do you actually capture these hyperlocal hotspots and take action? That is something to think about as well. But with that, that's the last slide that I have. I do request all of you to scan the QR code and send your feedback. But while we wait a couple of minutes for that, I'm happy to take any questions, thoughts about what you can do to improve air pollution, or do you have any clarifications? Please do feel free to ask. Thank you.
Yeah, there are a couple of questions. India's national ambient air quality standards are often higher than WHO guidelines. What are the reasons for this, and how can India align its standards with international best practices, considering its unique socio-economic and environmental context? And the second question, should I just share it right away? And you'll take both, one after the other?
Oh, let me answer that one. I think our standards were set, and they're definitely higher than the WHO guidelines. The guidelines values that I showed are the latest ones that were revised in 2021, and our standards were set about 10 years before that. At that time, the years well before that, the WHO guideline for PM2.5, the first one in 2007 was about 15 microgram per meter cube on an annual average basis. Or is it 10? I think it was 10 microgram per meter cube. Now they reduced it to 5 microgram per meter cube. But I think we definitely have to consider that our air pollution levels are really high. And if your annual average is often exceeding 60, 70, 80 microgram per meter cube of PM2.5, going to 5 microgram per meter cube, you'd have to basically, number one, stop all economic activity, which is probably not going to happen, right? And it's going to cause a lot of economic harm to a lot of people. The second one, there's also a significant source of natural air pollution in a lot of places. There is a lot of desert dust, a lot of road dust that also does show up in PM10 and PM2.5. And so you can't really avoid that. But what has been recommended, or what we do recommend, the WHO has interim targets. So the WHO has interim targets, and the first interim target is 35 microgram per meter cube for PM2.5, which is pretty close to the national ambient air quality standard of 40 microgram per meter cube. So going from 40 to 35, which is one of the targets that has been proposed, 35 microgram per meter cube across India by 2035, I think that would be a big step forward. Again, I don't want you to think that if you don't go to 5 microgram per meter cube PM2.5, you're not going to be safe. Any reduction in air pollution, you will be safer. That will reduce health effects significantly. That will improve productivity, reduce neonatal health effects for children, so on and so forth. So the goal really is to reduce it as much as possible, knowing that we do have a long way to go. There's a lot of natural sources. And we are also a developing country, so we really need to make sure that our citizens are adequately provided for. There's a lot of action that is being taken that I'm very optimistic about. There is the Pradhan Mantri Ujjwala Yojana, for example, which is replacing solid biofuels with LPG, which is much cleaner. There's also the big push for rooftop solar as well, which will help reduce a lot of these emissions. So a lot of action is being taken, and I think it'll just take some time. But again, any reduction is a benefit to human health and the economy as well. The next one.
Yeah, the next one is, how do standard PM 2.5 concentrations differ from population weighted values? And what are the implications for air quality assessments and public health policies, particularly in areas with uneven population distribution?
Yeah, that's a great question. I think in a lighter moment, I would say, that the health, there's only a health impact if there are people living there and breathing it, right? If there's, sure, there may be air pollution from a forest fire, but if nobody's living there, nobody's breathing it, by the time it actually comes to where there's a populated location, it may have significantly reduced, and the health effects will be much lower. Population weighted average what means that you basically measure the air pollution at different places, say across a state, and then weight those averages by the population exposed to that level. And so then you get a population weighted average for the state. And so that is more reflective of the health burden in your state, for example. So you're really more concerned about the air pollution near where people live. And so weighting it by population gives you that population weighted average. I missed the rest of that question. I think it just skipped by here. Yeah, essentially, you really want to focus on areas where there is population and high pollution as well to make impacts. So cities are, this is why the NCAP focused on cities, because a lot of people live in cities. So you really want to reduce pollution where people live. The only challenge is that a lot of pollution in cities also comes from other areas and other states, other cities. So
There's a compliment on the presentation.
thank you.
And yeah. Yeah, so if there are any more questions, before we would also request you to please share your feedback. We have been talking about how to, this is a problem that really affects all of us, and it has very far-reaching implications, but there's a lot that needs to be done, and there does not seem to be enough buzz from, from the people to sort of work towards finding solutions for this, or enough effort, in fact. And if anybody from the audience would like to sort of share their thoughts on what can be done, maybe some of you may have already been working towards something, and if you would like to share that, we would like to give you the space to do that right now.
And while people are thinking about their suggestions for what you can do about your air pollution or what action should be taken, I believe this talk is being recorded and it will be shared on our YouTube channels. So I think we can provide the link if you send an email to BSF.
Yeah. One question I had, Dr. Subbu, was so a lot of times, probably people confabulate air pollution and climate change, but they are not the same. If you could talk a little bit about that and the impacts or the relationship between air pollution and climate change.
Sure, definitely. So I think so you're right, air pollution is not the same as climate change. Air pollution is I think we are increasingly coming to the point where we do feel the effects of climate change today. But generally speaking, the impact of air pollution that you breathe in today is from sources that are emitting the pollution today, or within the last week or 2 weeks. Whereas the impact of climate change, a lot of it is really from carbon dioxide that was emitted decades ago. The carbon dioxide that is emitted today will still have impacts 100, 200 years down the line. And so whatever you're emitting now is warming the planet and will be warming the planet for the next 100, 200 years. And so you need to cut those emissions now. So that is important, right? But those effects will not be felt for a very long time, not within our lifetimes. On the other hand, air pollution, if we start cutting those emissions now, we can feel those benefits usually within a matter of weeks. So I think there are probably stories where, during COVID, when lockdowns happened and a lot of economic activity stopped, I think there was this viral story about Mount Kenya in Nairobi. Basically, a friend of mine took a picture of Mount Kenya in the middle of a lockdown, and you could actually see Mount Kenya very clearly. And that usually was not seen when there's a lot of air pollution, as normal. And the same thing in India as well. And so I think the idea is that with air pollution, the sources usually only last 1 or 2 weeks in the atmosphere, and then they are removed from the atmosphere. So taking action now will bring benefits within the same year for you. Where there are also some climate pollutants that are much shorter lived than carbon dioxide. So these include gases like methane, and again, the super pollutant black carbon that is emitted from diesel trucks and household solid fuel burning and forest fires and kerosene lamps. And that does cause, a significant climate impact. But again, so that's why we call black carbon a super pollutant, because a action taken can reduce air pollution and avoid, further warming. So any black carbon that we emit, so for example, there is a forest fire near the Himalayas. The black carbon there deposits on the glaciers and contributes to faster melting of the glaciers, which has other issues like disrupting water supply for the Indo-Gangetic Plain. To avoid that, we can cut those emissions now, and within a couple of weeks, we can actually, get the benefit of that intervention. And methane is another that usually has a lifetime of about 10 to 12 years. So even if but that has a huge climate impact. So one way to quantify the relative impacts of these short-lived climate forces like black carbon and methane is the relative climate impact compared to carbon dioxide. So something like methane, which is emitted from decomposing landfills, for example, that is estimated over a 20-year time frame to have an 80 times, the 1 kg of methane is equivalent to 86 kilograms of carbon dioxide in terms of climate impact, climate warming impact. The black carbon, which has a lifetime of a couple of weeks, it's estimated to have that's called a global warming potential. So methane has a global warming potential of about 86 compared to carbon dioxide. Black carbon is estimated to have anywhere from 1,500 to 3,500 as a global warming potential. So you could have significant climate benefits and air pollution benefits by reducing black carbon, and those impacts will be felt within a matter of weeks.
Yeah, thank you so much. So there's one question, and I guess if there is anyone else, we can take another question at the end of it before we end. Is there any effect on biodiversity due to air pollution? And if so, how important that is to focus on?
I mean, I do not have a good answer to that question. There are definitely significant impacts on vegetation, like ozone, for example, has a significant impact on agricultural crop yields. But yeah, and I think there's even impact. I mean, if we are breathing and we get sick, and so do animals, other flora and fauna, probably. And so we definitely want to try and reduce those impacts as much as possible. I do not know so biodiversity in terms of relative population of different animals or plants or whatever. I don't know the answer to that. There are definitely some plants I think that are more resistant to pollution than others, but I do not have a good answer to that question in terms of actual biodiversity impact. Sorry. Definitely something to think about.
Right. If are there any further questions? If not, I think we are almost at the end of the time in any case. But we really would, request all participants to please give their feedback. It helps us also to understand what more we can, focus on, or what are the other things that we should be covering, what other webinars we can bring you. So please do share your feedback. There's a scan and there's a link in the chat. And
Yeah, and we'll stay. I think we can just keep this up for another couple of minutes while people scan the QR code
Right.
and submit their feedback.
Right. And but before we end, once again, thank you very much, Dr. Subbu, for coming and giving us a chance to learn a bit more about air pollution. Usually, we feel like we know it, we understand it, but I think there's a lot more that a lot more attention that we probably need to pay. And I hope that today's session goes a little bit towards building some momentum on work on air pollution, which will have such a huge impact on our day-to-day lives. Thank you to Swagata and Anshika also, and others from CSTEP who have helped put the webinar together. And thank you to all the participants for staying with us. And do reach
Can I
out.
say something? Sorry.
Yeah, please.
Yeah, actually, so I think the one message that I would have for most people on a personal level, right? A couple of different actions that you can take. So waste burning is a significant component. So unfortunately, waste management is not super great in Bangalore, like many other cities in India. Indore is actually supposed to have a really good, waste management program, and there's almost zero waste burning in Indore. So it's the cleanest city in India. So one big thing that you can do is actually segregate your waste, at least do the dry and wet waste segregation, if not other types of recycling, for example. So that's one way to do it. The other way that I would say is try to do carpooling or try to use public transport, the metro, as much as possible. If you have a business, probably you should try and encourage more work from home or hybrid working policies so people don't use as much traffic, don't cause as much traffic, which causes congestion, also leads to greater pollution. Uh, if you're buying a new car, or probably buy an electric car, right? That's definitely better for the environment. And if you qualify for solar panels, definitely go for that if you can. Try to put solar panels on your house. That's a great thing. But yeah, I think, one other thing, I mean, if you ever notice at home, if you actually burn, incense and candles and diyas, that also does emit smoke and pollution. So we just want to consider avoiding that. I have a little air pollution monitor at home, and my poor mom has stopped burning agarbattis after seeing the monitor going to the red each time she lights it up. So, but anyway, something to think about. There are definitely sources of air pollution at home as well that we can definitely take action on.
Right. Thank you. Thank you so much for sharing those suggestions. And I hope we enough people start implementing them, and then we'll see the change. Thank
Great.
you once again.
Thank you all. Thanks.
All
Bye
right.
all.
Bye. Thank you.
Bye.